Okay. I think we can go ahead and get started. Next slide. Welcome to the Network for Public Health Laws webinar, AI in Public Health, Opportunities and Challenges. Thanks everyone for joining us today. My name is Megan Mead. I'm a Deputy Director here at the Mid-States region of the network, and I will be moderating today's webinar. Two quick housekeeping details. The presenter slides, as well as a recording of this webinar, will be available on the network's website within the next few days, and you'll receive an email notifying you when they've been posted. Also, please use the Q&A function throughout the webinar if you have questions, and we'll try to get to as many of your questions as possible. I will also be monitoring the Q&A throughout the webinar, and we'll try to consolidate questions at the end, or if possible, answer them during the course of the webinar. Next slide, please. We see a lot of opportunity for AI to support the work of public health, and everything from bolstering the capacity of the workforce by assisting with those time-consuming tasks to performing sophisticated analytics on data sets, including on data from non-traditional data sources, such as social media. There's also a lot of understandable concern about AI on areas like workforce displacement, privacy protections, the risk that AI actually perpetuates health disparities instead of reducing them. And these are very real and very understandable concerns. Many health departments are just beginning to dip their toes into AI and to think about it. So at the network, we're hoping that this is the first of resources that we can offer public health practitioners that will focus on AI. So our learning objectives today, what we're hoping you'll come away with is a basic understanding of AI and its potential risks, benefits, and applications, that you'll learn how state, territorial, and local health departments are using AI to advance public health and support their workforce, that you'll understand the key strategic, operational, ethical, and policy considerations on AI use, and that you'll also obtain an overview of ASTHO's legislative mapping work as it relates to AI in state and territorial public health agencies. So with that, let me introduce today's incredible speakers. We will lead off with Vivian Singletary, who's the Executive Director of the Public Health Informatics Institute. And then next we will turn to ASTHO, where we will have Greg Papillon, the Director of Public Health Innovation, and Maggie Davis, the Director of State Health Policy, speaking. And then finally, Dr. Phil Wong, the Director of Dallas County Health and Human Services. And then after that, we'll turn to questions. So I will now turn it over to Vivian to take us off. Thank you, everyone.
Thanks, Megan. I appreciate this, and welcome everyone to the webinar. Glad you could join us today. And please forgive my voice a little bit. I'm coming down with a little bit of probably the flu from my daughter and husband, so I'm gonna hang in there as much as I can today. So I want to start with giving an overview of artificial intelligence. Let's go to the next slide, please. One of the things, and Megan already mentioned, is job displacement. There is major concern about, is AI going to take over my job? Am I going to have a job? What does the future look like for me in terms of job security? One of the ways that I look at AI personally, just like you look at a smartphone, you look at the internet, these are technology advancements that we've learned to integrate into our workflow. And what I say, and I love this quote, AI won't take your job, but somebody using AI will take your job. So while AI is not going to overtake the human workforce, we need to learn how to use and harness this new technology. Next slide, please. I want to start off with the definition of AI, and this definition I grabbed from the National Artificial Intelligence Act of 2020. But the definition here, the term artificial intelligence means a machine-based system that can, for a given set of human-defined objectives, make predictions, recommendations, or decisions influencing real or virtual environments. And if we kind of pick that apart, this is not new. And so we'll go to the next slide. Uh, what this is describing is not new. AI is not new. AI has been around since the 1950s, and many of us have lived through multiple iterations of AI. As the technology has advanced, AI has been able to do more. Some of you may be familiar with the Turing test, Turing, from the early 1950s, where it was this test that was focused on trying to make it where a human could not distinguish whether it was a computer answering or a human being answering. Um, we've gone through other iterations. How many of you have seen the chessboard where the computer is playing a human? That's another example of AI we've seen over the years, all the way to, if you fast forward to, the 2010s, when we started to get into the smartphones, the release of, Google's AI assistant or Apple's Siri's assistant. Those became the more robust models where you could actually talk to um, a technology and have it respond to you. And then if you fast forward to today, what a lot of us are talking about, Chat GPT, Claude AI, and other large language models, we've seen this iteration, and we're going to see more iterations of AI as we go forward. I heard this comment a few weeks ago, and I thought it kind of struck me, but it said, "This is the dumbest that AI will be." And I was like, wow, that's interesting because there is definitely more to come. Next slide, please. So I want to talk about the types of artificial intelligence that you might hear people talk about. Narrow AI, general AI, and super AI, which we don't have yet. So starting with narrow AI, and I just gave an example of a narrow AI, like the chess game, the chessboard, the computer playing the human. Other things that we see with narrow AIs might include facial recognition software. If you've ever seen one of the self-driving vehicles that can take you from point A to point B, that's a narrow AI. Or if we all remember the early stages of Google Translate, which is much more sophisticated now in its latest version, but translating from one language to another. That's another example of narrow AI, but it's programmed to perform very specific activities with a very limited scope. Then we can move on to general AI. And this is where most of us are familiar and probably engage the most. And when we think about general AI, we typically think about large language models like ChatGPT or Gemini, Copilot, Claude AI. And one of the things that I always say, these models are not perfect. They are not perfect. They require significant human oversight. There are cases where, if you've been following and reading the news, where you've had an attorney use ChatGPT to try to do some research, and these general AI tools can hallucinate, and everything that was returned was not actual. It was citing cases that actually did not exist, which became problematic for that attorney who was, either I'm not sure if he or she was disbarred, or at least, they had to deal with some fines when they submitted their briefs because the cases that came back did not actually exist. And so we have to be careful with the use of general AI. It is extremely powerful, but I always say it's a beginning point. It may not be the ending point. What comes back from that general AI that we may be using. I also get the question about which one should I use? Which large language model should I use? And these large language models are continuously evolving. And I say use them all. Oftentimes I may use ChatGPT and compare the results with another model because they're all evolving at different speeds. So, feel free to use them all. And then the final one is the super AI, which it surpasses human intelligence. And theoretically, this does not exist today. I would say we're getting closer to this. The latest evolution of AI is this angenic AI, which is getting to the point where it can do reason and rationale more similar to a human. And think about the context of which the question was asked by the user so that it can give more relevant answers. Next slide, please. And so I want to dive into a little bit more because this is where a lot of us engage is generative AI. And so generative AI, a few different things. It generates new novel text, images, audio, video files. I'm not sure if some of you have seen, you can take a picture of yourself and literally create a full-on video. You can give it the words and it will move the picture, your mouth in the picture to go along with the words that it's saying. And use your own voice over on it. There are some amazing and pretty just pretty amazing tools out there that you can use. We talked about all of the large language models, but you can use some of the AI tools to create brand new images. The creatives are a little concerned about this. I remember reading something about one of the movie studios here in Atlanta, and they said that they're going to hold on their expansion because of these AI tools, and they can do so much more with AI versus building out a new studio. So there's some powerful things to come with the content that it can create. And then it uses these machine learning algorithms. It is using content, which I'm sure we'll get into more with the other speakers, that exists today to help generate the new content. So there are these algorithms that are programmed to kind of, search what's out there now and generate new content. And like we've already talked about the diverse applications of this new generative AI tools, the many tools that are out there today. All right, next slide, please. So here are some practical applications of generative AI, and we kind of touched upon these, and I'll just go real quick. So content generation. So if you are wanting to write a letter, write a book, tell a story, create a short movie, you can use generative AI to do that. We talked about language translation, very helpful to translate from one language to another very quickly. And now you have that language translation where you can literally listen to someone speak in one language and hear the results in your own language through headsets now, automatically generated by the AI that's there. We talked about image creation, video creation, amazing high quality videos and images. Task automation. Those are some of the things that we're going to probably get into as we talk about how we use AI at the jurisdiction levels. How do we make our work more efficient? How do we streamline it? Can we leverage AI to get us there? And these personalized assistants, a lot of us already are leveraging that with Alexa or Siri or Hey Google. These are these interactive virtual assistants that we can talk to, set timers, set schedules, can do a ton of different things. So these are some practical applications of generative AI that some of us may already be delving into. Next slide. We kind of touched on this already, and so I won't drain this. So some of the things that you may do in your own specific work with AI, create logos, copy edit your writing if you use things like Grammarly. That's an example of a narrow AI that's focused on making sure that your grammar is correct. There's tools out there to help you respond more efficiently to all of the emails in your inbox. You can use it to help you draft proposals. You can use it to help you brainstorm. And many people I know that I work with use a tool called Otter AI to do the meeting minutes and summaries. So instead of somebody typing furiously in a meeting, this is, the tool that they're using, and it generates just just amazing results in terms of the meeting summary, giving you the next steps, and being able to send all of that out right at the end of the meeting. It just, advances what we're able to do and turn around very quickly. Next slide, please. And I'm not going to drain this because I know other speakers will get into this. So AI is not without its challenges. One of the things that we're going to get into a little bit more is the bias in the data that's used to create the new content. So we already know that the data that exists is biased. So you're bringing that into, the generative AI. And so we have to figure out ways that we can adjust for the bias in the data. Other challenges, workforce readiness. So how do I, as a person in public health, how do I start engaging with AI? What are the things that I need to do, get trained on, learn so that I'm ready to use AI in my work every day? Another piece where organizations um, have to spend more time thinking and putting things in places around AI governance. There needs to be processes and policies in place on how AI tools will be developed, how they will be rolled out and used, how they will be governed, in terms of that feedback loop. If things are working or not working, how does that entire construct work? So that's another piece that has to get put in place. We talked about the potential for misinformation. These tools are not are not flawless. So how do you make sure, and what are the processes and policies that you have in place to ensure that the information that you are using from AI is correct? And there's also ethical implications with the use of AI. Is this the right thing to do? Like we talked about generating images, using, other images as the base that may or may not be copyrighted. Should we be using that to generate something new? And then there's technical limitations. Again, this is not flawless. We talked about the fact that AI doesn't always have all of the right context and rationale. So there are definitely challenges that have to be overcome and balanced with, this new and developing area of AI. So lots of great opportunity, but also some challenges that we have to work through. All right, that's it for me, and I'll turn it back to you, Megan.
Thank you, Vivian. That was wonderful. I'll turn it over to Greg and Maggie at ASTHO to take us off next. Thank you.
Thank you. And I think I can speak for Maggie myself and just saying thank you to our friends at Network for Public Health Law for organizing this. It's a pleasure to share the virtual stage with our counterparts at PHAI and Dallas County. It's great to be here. If we could jump to the next slide, just for those of us who are not as familiar with ASTHO, Maggie and I work at the Association of State and Territorial Health Officials. We are the national nonprofit that represents the senior-most health officials at each of the 59 states, territories, freely associated states, and the District of Columbia. So we are here to provide the state and territorial perspective on considerations and opportunities as it relates to AI use in public health. Next slide, please. So for today, on the ASTHO side, we had three things we wanted to touch on. I think Vivian, such great background there. I think we will breeze through our end of the background since we have such a great foundation to kick off from, serving 59 health agencies. As you can imagine, we tend to have conversation across the spectrum from agency leaders and staff who have never touched ChatGPT or any other AI chatbot to informatics directors who are building tools, AI-powered tools in-house. So I found it helpful to ground these conversations in those kinds of definitions. If we could jump ahead 2 slides real quick, I will just reiterate one point around the kind of narrow AI, general AI distinction. So Vivian mentioned how long narrower AI functionalities have been around. That's true in public health as well. So we've seen documented use cases decades back, and that kind of complicates the conversation, I think. You have people who are talking about this within the scope of these newer generative AI tools like ChatGPT, but we also have AI applications and use cases that go back decades. So I'm going to do my best to kind of articulate the distinction between the two as we're talking about both documented use cases and applications and opportunities moving forward, especially considering that generative use cases are still emerging and are still undergoing evaluation in terms of their effectiveness, in terms of their efficiency. So we'll focus on that as well. Next slide, please. So speaking from the perspective of state and territorial health agencies and their leadership, we have been hearing both from our members and from thought leaders across the public health sphere kind of three larger buckets of considerations outside of just opportunity assessments. These are some of the considerations that are going into agency policies and guidelines, starting with areas of ethical considerations, which will span, we'll go a little bit deeper into these, but issues of equity and bias, which Vivian touched on. Privacy and security is obviously an important consideration as well. And then this issue of transparency and kind of the black box issue of some of these more complex AI models. From the operational and implementation perspective, data governance obviously considers several of these ethical considerations, but has its own process and stakeholders involved. From a leadership and workforce perspective, leaders and staff in our agencies have a need to kind of expand their expertise and their capabilities around these new wave of AI tools to better understand what the opportunities and risks are. And ASTHO is doing our part in participating in events like today, providing technical assistance and legislative tracking to ensure that our agency leads are up to speed on what they need to know about AI. Funding and sustainability, I think, is its own challenge when it comes to AI strategies and policies. AI tools, I saw a comment in the chat about there being kind of free versions of things like ChatGPT. Those are out there. It's been referred to, I've seen, as kind of democratization of AI tools. One thing that's important to keep in mind, both from an individual user perspective and from an agency policy perspective, is that there are very different terms and conditions at these companies around how the data is used, depending on whether it's a free account or an enterprise account that would be entered into by an entire agency or an entire team. So we'll get into that a little bit more. But bottom line, from the operational and logistical standpoint, I think, is evaluation and accountability. You hear a lot of the term human in the loop, and I would agree with Vivian. These are not infallible tools and models. You are going to get what we call hallucinations, which are when inaccurate information is produced by an AI tool, and having evaluation and measurement processes and policies in place are critical to ensure that human's in the loop and we are abiding by those policies. Lastly, I think we're going to spend a little bit less time on the federal side, given the point of transition we're in right now between administrations, but looking forward to Maggie's time discussing some of our legislative tracking at the state and territorial level, as well as talking a little bit about state agency policies and guidelines outside of the legislative arena. So if we could advance one more slide here. So going a little bit deeper on the ethical side, so equity and bias is something that we have had a lot of conversations with our membership about. It does seem like the operations of this is still being developed. There are steps you can take when you're considering the inherent bias in any data set. And most organizations that advise on AI strategies will advise something like an end-to-end risk assessment, talking about data collection and management analysis and disposal. But you want to make sure that your data is representative of the population you're serving. There's a lot of different guidelines around this. You can see a few of the publicly available frameworks on the right-hand side here. Expanding on the privacy and security questions. This, I think, is part and parcel of most agencies' governance policies. So really, this is just an expansion of governance with how agencies approach it. I'm going to go a little bit deeper in the operations section around how organizations like NIST have provided frameworks for this. But from a transparency and explainability standpoint, it's really important for public health practitioners who are leveraging these AI tools to be able to justify their decisions to their populations they're serving or to other stakeholders. And there's an inherent trade-off with these more complex AI. There's a trade-off between these more complex models in how explainable they are. That's the nature of how complex the tasks are they're being asked to solve. So that's all part of what agencies need to consider in their AI policies. Next slide, please. From an operations perspective, I think I touched on a few of these. Data governance is central to a lot of these ethical and privacy and security ethical considerations around equity and bias and privacy and security. HHS's recent strategic plan around AI acknowledged some of the limits that I referenced around the cost of enterprise AI solutions and how there are resource constraints in states, territories, locals, and tribals as a barrier to that democratization of AI use without that added risk of some of the terms and conditions around the free tool use. So again, I'll just double click on that AI RMF playbook that NIST has put out, because we are hearing from a lot of our members from a data governance and general risk assessment perspective. This is how they're looking at their agency's approach to AI implementation. That's important to understand from the evaluation and accountability perspective as well. Keeping that human in the loop, making sure that you're treating any content that an AI tool produces as if it were produced by staff, going through the same reviews and verifying the data and facts that are coming out of it to ensure that it abides by your agency standards. Next slide, please. So I mentioned some of the shifts in the federal landscape from policy considerations. Anything that the agency puts into place from a strategy to guideline perspective will obviously need to abide by federal and state legislation and regulations. Most of the federal approach to AI development and public sector use was until recently in line with the Biden administration's executive order that you see on the right here around safe, secure, and trustworthy use of AI. Among the flurry of executive orders that President Trump signed this past week was a repeal of this executive order, signaling a shift towards deregulation in the AI domain. So something to keep in mind as we shift into that new environment. And I think that puts more of a spotlight on the state and territorial legislative landscape, which we'll touch on a little bit more here as Maggie touches on ASTHO's legislative scanning. But I did also want to reiterate the importance of state agency policies. These can be health agency guidelines and policies around AI use, but we've seen just as often there is a central administrative or IT agency that does a statewide policy around AI. We also have states who have, at a statewide level, a ban on use of AI for some or nearly all uses. But this is also important to consider back with those definitions around narrow versus general AI and how some of these narrower AI use cases have been in place for decades, and agencies are having to reconsider how they report those and evaluate those now with new policies that were aimed at generative AI tools. Next slide, please. All right, I want to take a few minutes to just touch at a high level on some of the documented use cases. I mentioned that a lot of the evidence and documented use cases around AI in public health predates the generative AI wave of tools. We've seen several buckets where a lot of this evidence tends to fall. The first is in public health planning around things like policy, program, and intervention planning. We've seen models and simulations that, for example, can simulate the impact of beverage taxes on health outcomes. We saw the health department in Los Angeles using AI to select youth advocates for an HIV prevention program that ended up outperforming traditional selection methods. From a disease surveillance and outbreak detection, this goes back to the COVID-19 response, but also the Zika response. We saw AI models predicting disease spread in both of those epidemics and analyzing diverse data sources like social media and news reports. There was a tool called Blue Dot, which identified early signs of COVID-19 by analyzing airline and news data, among other unstructured data sources. And that's one of the big areas of AI capabilities, is those unstructured categories of data. Emergency response, there's a pretty good evidence base around AI tool use in these areas, modeling evacuation plans, allocating resources, even analyzing wearable device data to support triage decisions. It can also expedite information delivery to first responders by using satellite image classification and social media analysis, more unstructured data sources that you can see AI tools really kind of empowering health and health security staff to enhance their capabilities. Health communication and promotion, we've seen a good amount of uses, but this is one of those areas that I think is front and center as we get into these newer generative AI tools. We saw AI-powered chatbots even before ChatGPT. We followed one called Layla that was developed in Onondaga County, New York, that provided tailored health information to underserved populations. We also see generative AI as being able to streamline communication by summarizing public health topics and even potentially combating misinformation. We've seen some of the larger AI providers suggesting approaches to that. And then just recently, we saw the DC Department of Health working with AWS, Accenture, and Anthropic, who does the Claude chatbot that Vivian mentioned earlier, to develop a health information chatbot. So that's kind of building on that Layla model, but incorporating those generative AI capabilities to make it a little bit more autonomous. So I think from there, where we see additional opportunities beyond what you see here that may not have hit the evidence base just yet, is states using chatbots to help navigation of online resources. We've seen a couple of states kicking off pilots for this, helping kind of no wrong front door approach for their populations to get information no matter which website they start at. These chatbots can help navigate them. I mentioned HHS's new strategic plan. They've mentioned opportunities within some of these domains, as well as I think sector and field agnostic opportunities that you hear around efficiency through automating repetitive tasks, and but they also see a lot of opportunity in health access through generative AI. And then just last year, we had a large group of senior health agency officials meeting at our executive leadership forum, where they brought up opportunities that were outside of here in enhancing public health efforts through storytelling, through tailored communication, grant management. We also saw doubling down on HHS's priority around streamlining workflows, automating mundane tasks like abstracting data from medical records, layperson-friendly language being extracted from technical texts. They raised opportunities for interagency collaboration, both facilitating insights across and interoperability across agencies, but also collective purchasing power. And then opportunities for customized training and education. So tailored training to staff learning styles and service areas, and identifying emerging trends that require training. So I think the possibilities feel endless here. And one thing we've been trying to do with these buckets is try to identify where those opportunities really are. And I think from here, we wanted to take a step back and revisit that conversation around legislative trends. So with that, I will hand things over to Maggie. Maggie, it's over to you.
All right. Thank you, Greg. And can we go to the next slide, please? So I'm going to give a little bit of an overview of some of the legislative tracking work ASTHO has done and related to artificial intelligence. But before, wanted to share a little bit about how ASTHO approaches legislative tracking and legislative analysis. One of the groups that ASTHO supports is a peer network of legislative liaisons. So these are the public health department employees that serve as that link between the health agencies in the executive branch and their state and island legislatures. And so our team provides a lot of technical assistance, helps connect legislative liaisons together, particularly if they have a shared problem. One of the things that we have started to see an emergence of from both our kind of capital M members, the health officials themselves, as well as the legislative liaisons, has been that impact of artificial intelligence. But that's really kind of a new and emerging trend. So one of the resources that we put out as part of our legislative tracking work is we do an annual legislative prospectus looking ahead at what are going to be kind of the top public health issues before the state and island legislatures for a given year. For 2025, we highlighted 5 issues, one of which is data modernization and privacy protections related to public health. So some of the major trends we've been seeing are enhancing protections for consumer health data. So we've been really monitoring to make sure that there remain public health exceptions in those laws, similar to what's in HIPAA, so that public health can continue to do its kind of bread and butter work of monitoring disease outbreaks and getting data on population health. Similarly, we've been really monitoring efforts to set up and strengthen health information exchanges and making sure that public health is really integrated into the healthcare data exchange landscape. And then back to that kind of core public health, those vital records enhancements. So there's been a big push to modernize vital records, try and have more digital records, and making sure that we have kind of the right authorities for those core vital records, such as death records, birth records, marriage records. But really in that looking ahead, we are looking at things like how AI standards impact public health, as well as a few other topics like the adoption of the TAFCA, the Trusted Exchange Framework and Common Agreement. But focusing on AI, if we go to the next slide, please. With the support of the Public Health Infrastructure Grant, ASTHO's team has been able to start tracking a handful of topics related to public health infrastructure and workforce. And one of those topics that we've included has been artificial intelligence. So we have a tracker, and I can put a link here in the chat to the direct page, hopefully, or maybe I'll do that in a second, or Greg can. This is a longitudinal map, so it is going to show you legislation introduced from January 1st, 2023 through September 30th, 2024. There are plans to continuously update this map. September 2024 was just our last update. And this will show you legislation that we have identified that falls into 2 categories. One, governmental use of artificial intelligence, so a body that was put together, so say a task force or directing a certain agency within the government to really analyze how the state government is using artificial intelligence. And really, it's been a range of definitions of AI. So both Greg and Vivian went over kind of narrow AI or Gen AI, This kind of runs the gamut across that. And then the other piece we've been tracking is the use of artificial intelligence in employment decisions. And so this would include government employment, but it's also a lot of these pieces of legislation also include private sector employment. Can we go to the next slide, please? So as a high-level overview, from what we have tracked in 2023 and 2024 so far, there's been a lot of movement in this space. At least 27 states considered legislation related to the governmental use of AI, and 14 states passed bills. And again, a lot of this legislation focused at that kind of first level of putting together a task force and really assessing how the government had already been using artificial intelligence. And again, this is where you kind of include some of that older machine learning. And so there's a bit of an effort of some jurisdictions really trying to wrap their arms around what are agencies currently doing and what are they wanting to see looking ahead. That said, we have started to see a handful of laws that do take that next step in putting some guardrails around how the state uses artificial intelligence. The one I wanted to call it here, but this past December, New York's legislature enacted a new law that will now put some guardrails around the use of AI when they're in some sort of public assistance benefits or some sort of decision of consequence. And you can imagine where this comes from. There's been a handful of lawsuits in 2024 of states that used a vendor for their Medicaid systems that allegedly the AI system denied Medicaid benefits to people that would have otherwise been eligible. And so this caused a big concern among a number of legislators. So you see things like this New York law that has come into place, really heightening scrutiny of the use of these systems when there is some sort of decision of consequence, or in the New York case, would, quote, materially impact civil liberties or certain constitutional rights. And then the other area that we've been seeing is really this use of AI in employment decisions. And again, in this 2-year period, 15 states had bills considering some sort of guardrails around AI and employment decisions. 2 passed bills. And again, this is really focused on that consequential decision. So as Greg highlighted, what we're really seeing is states trying to put their arms around kind of how is AI already being used and what sort of guardrails or protections need to be put in place. And then the other thing I wanted to highlight from what Greg shared of kind of getting that assessment of what does this mean, as Greg mentioned, there are some states that have implemented some sort of ban or halt on the use of AI for some period of time. In that case, we have heard reports of that having some negative consequences. So some of this has been kind of built into day-to-day operations. So the one example that comes to mind is we heard from a state where the agency had a ban of contracts that use AI and found out that one of their common vendors had already been using a form of machine learning because the way they defined AI included some of that machine learning that had already been in place for several decades. And so that's part of the kind of thorny policy web that people are trying to figure out as they get their hands around this emerging technology. How do they draw the lines around existing technology? And how do we make sure that we're still able to meet the needs of the public health agency with the use of these technologies and kind of building in as guardrails as appropriate for AI moving forward. All right, and with that, I think that covers my high-level overview, but this is definitely a emerging policy space for public health and state government as a whole. I think we are now moving over to colleagues in Dallas.
Yes, hi, thanks. So I'm Phil Huang. I'm Director of Dallas County Health and Human Services. We're a full-service public health department. But we serve 31 municipalities and a population of over 2.6 million. So I did point out, and we've heard from ASTHO, we're actually by population larger than 15 states. So we do serve a pretty significant group. If I could have the next slide, just real briefly, sort of supplementing what Vivian presented earlier. I think And this is some slides that presented with A.L. Darman with Accenture at a couple conferences that I'll talk about in a second. But, really some of the best tools and the things that AI does best, some of the video creation. And, I think an AI created movie won the 2022 Cannes Film Festival in short films. Coding is something that have identified, for developers who enabled that 40% of their code was written by Copilot. And there's a whole lot of use. And actually, we've done some of that at Dallas County, and I'll share a little bit of that in a second. To image creation that you've seen, this is an example, one of the most famous applications. And this won a top prize in a painting competition. And then text, which is really already passed. Some of these business exams, law exams, medical exams, different things that the text and use of AI for that. And then speech synthesis and translation, which you've heard about. And next slide. Yeah, so the next slide just shows, just how far we've come and sort of this history. But essentially, as you heard, it's been around for a long time. But you think about, I think it was 1997 actually, when Deep Blue for the second time around defeated Garry Kasparov at chess champion. But you can see through the 2000s where we've come is where there you can see that dotted line, where average human capacity. So we're now at present where for speech recognition, image generation, and language reasoning, it's now surpassing average human capability. And this is why it's really, this most recent developments have been just so incredibly impactful. Next slide. And, we talked a little bit about impact on workforce and taking jobs. This was something from Accenture research, just looking at how AI will transform work across different job categories, and shows the work time distribution by major occupations and the potential AI impact, where the purple area is high potential for information using AI and automation, and then the green higher potential for augmentation. So between those two areas, really significant impact with that purple and green on these different job categories. Next slide. And so, we heard about ASTHO, and for the state health departments, NACCHO, which is the National Association of County and City Health Officials, released in August of this year their sort of public health informatics profiles survey results, and found that most local health departments were not using AI or machine learning, but and not 39% of these local health departments were somewhat or very interested in doing so. That large local health departments, 24%, were more likely to currently be using AI or have plans to use AI in the next year, compared to small and medium health departments, which, it's only 5 to 7% using it. And then again, only about among the 5% of local health departments that were actually currently using AI, most common use was for generating communication materials or plans, and 78% of local health departments perceived threats related to using AI, with most common concerns being reliability of AI and potential threat to data security. So next slide. And I've been doing several presentations on this, and the future of it and the sort of the changes in this area are really going fast. And so I did first presentation at CSTE in Pittsburgh in June of this past year, and that's all the Council of State and Territorial Epidemiologists, and it was packed. Standing room only for this, because there's been such interest in this topic. But I asked all the the people, like, how many of you have even used or downloaded ChatGPT? And I was really surprised at that point, and this is June of this past year. There are probably 50% at least had never even downloaded ChatGPT. And then I presented at NACCHO in Detroit in July of this past year, and that one I presented with A.L. Darman with Accenture. We took, if anyone was there at that meeting, we had the whole it was, again, packed room. We had everyone step out in the hall, and he had people, okay, on one side of the hall, if you're a score of 0, where you're really skeptical of AI, have no interest, really don't think you're going to use it. And then on the other side of the hallway, 5, where you really feel like you're already using it every day. It's become a part of your workflow, and had people sort of line up where they were across that spectrum. And it was really interesting to see. And he had been doing this at many different meetings over the prior months, and said how with the shift, there were still a significant number of people at that 0 side, but not as many. And and he's seeing that shift more to the side of the 5, and definitely. And then did another presentation at APHA in October in Minneapolis, and again, seeing more of this shift and how fast all of this has been changing. Next slide. One of the things that also in the conversations kept asking, how many of you have, and this is for health department, local health department and state health department people, how many of you have policies that prohibit use of AI? And as we heard from ASTHO, there are quite a few that are having those prohibitions, and I'll talk about that in a second. But I wasn't sure exactly and we were talking among local health departments, how do you actually implement that? I mean, does that mean you can't? I mean, certainly on state or county or governmental machines can't load ChatGPT, but does it mean you can't use it on your phone, or what is that? Because the cat's out of the bag here. And I'll talk about that. For us at the county level, NACO is National Association of County Officials. Have set up sort of an AI county compass that I think had some good guidelines for. We don't want to prohibit everyone's use, because there is so much potential that we see with this, and but we need to have those guardrails. And so one of the things, so these are some of the AI issues and use cases for local health departments that, we've been implementing a lot of it, or much of it in Dallas County. Actually, I'm going to put in the chat an article that was in the APHL Lab Matters, shows some of the things done by our lab team. But one of the things that I've said in the prior presentations I've been doing, if you get one thing out of this conference, for those of you that have not even downloaded ChatGPT, just do that and play around with it, because you'll see how, and just on the first day, you can see how this is a tool that really, helps, it changes your life in many ways. And maybe now that we're in January 2025, if you were to survey this group that's online, everyone's already downloaded ChatGPT. But again, I've been surprised at these conferences how many have not even done that. But for, as you've heard, some of the text generation, but drafting correspondence, even just to do for that, I use it all the time to draft a first draft of some correspondence I'm going to do, some message or even talking points for different presentations. But one thing, and we've heard, you can't just you need to have the human element of it. Monica Burrell with Google, who was one of the co-presenters with me at APHA, I think describes it. You should treat AI like a superstar intern. And they're like, these interns do amazing job, but you wouldn't just take what they've written or produced and put it out there without checking it over and looking at it. And so it is a very similar thing. I mean, these are, incredible superstar like interns, but you need to look through it and make sure that, again, all the issues about hallucinations or that the data is right or bias, make sure that it goes through that. But also grant writing. I mean, we've used this to assist with grant writing for many grants. I don't know if our funders are on and would not like that, but it's a tool that helps us with some particular sections of those grant applications for information processing. For those of us, and this is, and again, I appreciate Network for Public Health Law sponsoring this, but for us, even at the local level, just if there's a draft bill or something, I can throw that PDF into ChatGPT and they say, give me a brief summary of what this bill is saying, or what are the key points, other things like that, or any other some of our county court orders, other things, can just get a really brief summary and processing of that information. Health communication, we've heard about the AI-driven chatbots, virtual assistants for health education, and language translation. Again, for us with public health education, to be able to use to translate a lot of our materials that we're getting out to the public into multiple languages to meet the community needs. And then, as we're getting more of the social determinant data and other information, we can really customize those messaging and health communications. The natural language processing, we're using AI to pull some of the language and use it for data mapping, ingestion, and of data, various data sources, and pulling that data into our data modernization efforts. For disease surveillance, as we've heard, real-time tracking systems, and we're working with University of Texas at Austin, who's doing funded with CDC Office of the Forecasting and Analytics on some of the predictive analysis. Writing code, as I mentioned in that APHL article that I threw in the chat, talks about some of the things. You can even have it write code for Excel, things that you want it to do in Excel, for scenario analysis and planning. And as we've heard, the ethical and privacy considerations, data privacy and security. I told all of our staff that don't put anything that you wouldn't publicly want out there into ChatGPT. No protected health information, anything like that, and anything you have to consider as public, unless you have a private closed LLM. But then, transparency, also ensuring AI decisions are explainable and trusted, and then addressing the biases in the AI algorithms. Last slide. And just, a reference that AI County Compass from NACO. I think for us at the county government level, what I like about it, it's, putting guardrails on, but not saying prohibit AI, because I think that would be unnecessarily restrictive and really, sort of prohibit and sort of restrain us from taking advantage of the many advantages of being able to use AI. But, be proactive, not reactive, and utilize it with guardrails and guidance rather than saying we're not going to allow use of it. But maintain that vigilance regarding when it comes to accuracy, privacy, bias, and ethical challenges, and communicate how it can bring positive changes to the workforce and address challenges up front. Establish those functional requirements for implementing the systems, including strong data and governance measures, and then plan ahead for the transition to these new tools that are coming about. So I know we're coming up on time. Let me stop there, and I don't know if there's going to be time for additional questions.
Thanks, Phil and Greg and Maggie and Vivian. That was really excellent. I think far and away we've got the most comments and questions regarding the environmental impact of AI, everything from emissions to water use, and concerns about that. There were some, I think we're probably a little too close to the hour to really get into that. But I did want to say there were some comments in the chat that suggested ways to limit those emissions in the application of AI. But I will open it up if anyone has anything that they wanted to quickly add on that before we close out.
One thing I might add, because I see in the chat something, how many local jurisdictions are already using enterprise AI. One of the things that was mentioned in some of our discussions is you think about, these AI tools are going to be integrated into a lot of AI enterprise software that we're already using. And you think about like word counts or spelling checks that started out as these separate software that you applied, and now they become integrated into everything we're doing. And that's what I think we're starting to see also with AI. So it's going to be part of these other software tools that we're using.
An excellent point. And Greg, I saw you came off mute.
Yeah, Megan, I think one thing I would add there, Phil mentioned some data he had seen around local health agency and
Mhm.
department active use. I think you said it was somewhere in the neighborhood of 10%. When we ran a poll of our informatics directors in mid 2023, and we saw a response of about 35% reporting using AI, mostly Gen AI, in some kind of official capacity. But I think one other thing we've heard, and this is an important consideration, I think, for the folks making that policy, is there's an understanding among leaders and informatics directors that if policies are too restrictive, then the use of these tools end up just migrating over to personal computers or some other kind of informal setting. So having practical policies around their use has been the priority of most of the jurisdictions we've talked to. We are hoping to get some new data on the rate of AI use in our agencies across the next few months.
Great, thank you. Kayleen, do you want to go to the last couple slides? All right, thank you everyone for attending. Yes, we've got lots of questions too. And will the webinar and slides be available? Yes, they will in a few days. And you should get an email when they are posted on the website. Next slide. And then the last thing I wanted to mention was our conference that we will be holding in September, the 16th through 18th in Seattle. We hope to have at least a session or part of a session that focuses on AI, but sessions will cover the whole gamut of public health, lots on data and health equity, harm reduction, and many other areas. So please register. Also, feel free to reach out to me after if you have questions or anything that came up. And I'll do my best to assist. All right, and big thank you to our speakers today. And thank you to everyone for attending.